Hi, this is Dr. Swolensky, and I wanted to talk to you today about low back pain and its effects on you. The objectives of what we're going to talk about will refer to spinal anatomy and physiology. We'll talk about current back conditions and treatment options, and we'll talk about what you can do to fix those things. Some basic spinal anatomy. Your spine is made up of separate different areas, including the cervical, thoracic, lumbar, sacral, and coccygeal area. Those all make up the spine. The spine is one unit. So anything that affects one area has a global effect. But we want to specifically talk about the lumbar vertebrae today. And that means that that very low back area, that's what's referred to as the lumbar area. Now your low back is designed to bend forward and backward. It's designed to be able to tip, laterally bend from the left to the right. However, it's not really well designed to twist, and that's where a lot of different damages comes from, creating a lot of low back conditions. What's more is the nerve is really the biggest thing that's being impacted when we have low back problems, because those delicate nerves control everything going on in the body, and anything that interferes with them creates bigger problems. Well, the intervertebral disc is one of the offending things to the nerve. Now, the disc itself is made up of an outside part called the annulus. That's layered like an onion. That's designed, though, in those layers to keep that nucleus pulposus, the part in the middle, the jelly grape-like material, right in the middle. However, through chronic things and over time, that nucleus pulposus breaks through the annulus because of different damage, leaking out. That's what creates a lot of your severe and chronic low back problems. Now, I also want to talk to you about what changes and increases the pressure to the disc. Now, we'll refer to millimeter of mercury of pressure, and that's the kind of, when you get a blood pressure reading, say 120 over 80, that means 120 over 80 millimeters mercury of pressure. That's just a unit of measurement. When you're laying down, the disc actually has an intradiscal pressure of 75 millimeters mercury of pressure. When you go to lift something and you're using your legs lifting properly, that pressure to the disc increases to 400 millimeters mercury of pressure. However, if you're lifting and you're just using your low back, that increases it to 800. So you can see why it's so important to do things the right way, but also the effects of doing things the wrong way and what that has to damage to your body. So the main causes of low back pain, 70% of the problem is from sprains and strains. 10% is from degeneration of the disc. 4% is from herniation and bulging. And 4% is from osteoporosis and fractures. I want to talk more, though, about strains and sprains, because very often strains and sprains, which the symptoms may go away in a couple of days or a couple of weeks, are rarely properly healed. And that being the case, if those aren't properly healed, we start altering the way that our body is doing things, which means more wear and tear and more damage is going to happen in the future. That's why the sprains and strains part has such a high ranking. So what are some of the common ways to evaluate the lumbar spine? That's the use of MRI. MRI is designed to evaluate bones, discs, joints, soft tissues, and nerves. Its primary focus, though, is the soft tissue and the nerves, and seeing what's going on with the disc. So now, as far as when you have back pain, you have some different treatment options. You can try bed rest, medication, general physical therapy or exercises, injections, surgery, chiropractic care, acupuncture, or spinal decompression. Now, as far as bed rest is concerned, bed rest is usually the first line treatment by standard medical protocols. The problem, though, however, with bed rest is because you're not getting to truly fix the problem, it's usually going to just mean bigger problems into the future. The same thing goes for the next option, which is medications. There's many different types of medications that someone would be prescribed. There are such as muscle relaxants, steroids, non-steroidal anti-inflammatories, pain medications. Now the problem, though, with medications is because that's only addressing a symptom, if you don't fix the core problem, it's only going to come back worse later on. Another option is general physical therapy. Physical therapy usually focuses on relieving pain and improving range of motion, changing posture, preventative training and conditioning. However, with the typical techniques that physical therapy does, with severe low back problems and disc issues, physical therapy often will aggravate that disc and not let that get well. If the physical therapy angle doesn't work, then you'll often be prescribed injections. Interestingly enough, research coming out within the last couple of years shows that after 50 years of use, injections, facet injections or epidurals for low back problems are relatively useless. Then there's the next option is surgery. There's many different types of spinal surgeries. The goal of nearly all the operations, it's to actually remove pressure from the spinal nerve and to stop excessive motion between vertebrae, 2 or more. The types of surgery really depends on the patient's condition and age, and a few of the most commonly, frequently administered surgeries are laminectomies, where they'll remove part of the bone, or a discectomy, where they'll remove part of the disc that's pushed out from where it's supposed to be, or lumbar fusion, where they'll fuse together 2 or more of the vertebrae so they're not moving at all the way they're supposed to. Unfortunately, though, surgery has only shown a 35% success rate. Another option that people try from an alternative route is chiropractic care. Chiropractic care is founded on the principle that proper maintenance of the spine through the adjustment will ensure the well-being of the body. What chiropractors do is they apply a specific adjustment to the bone surrounding the spinal cord to relieve spinal pressure so the body can function more appropriately. Another option that people can try is simple traction. With simple traction, you're either laying on your back or on your belly. But as traction is used, only 4 to 5% of the pull is actually going to be received at the joints of the spine. Meaning that if your lower back is the problem, if 100 pounds pull is used, only 4 to 5% of that pull is actually going to affect the area where you have a problem. That's why simple traction has such a low effectiveness rate. Approximately 14% of patients report improvement with simple traction. Results are usually very short term also. Now the DRX 9000, it received its FDA clearance in January of 2001. It was designed by neurosurgeons and medical engineers of 15 years, after 15 years of research. The DRX actually creates intermittent disc distraction, which is a key component in restoring discal hydration and health. What it is used specifically for is disc herniation, degenerative disc disease, facet syndrome, and it actually creates a negative intradiscal pressure of up to negative 200 millimeters mercury of pressure. So you're creating a negative state of gravity at the disc, which allows the disc to be reoxygenated, rejuvenated, rehydrated, and renutrified. And that's the key component of why the discs degenerate in the first place. They're not getting the proper nutrition because the joint isn't experiencing proper motion. The DRX also reduces discal scar tissue, and studies reveal an off-the-charts success. And what really comes down to it is the angle distraction the DRX uses. You see, we can specify based on angles where we're going to hit and what discs that we're going to affect, thereby applying 80 to 90% of the pull to a single segment, resulting in a more effective reversal of the degenerative process. In addition, the DRX software creates an intermittent disc distraction, which is a key to restoring that disc health. You know, again, before and after MRI show great treatment or great results. Now, the treatment protocol itself, in order to participate, you have to be evaluated. And if you qualify, the most common typical starting off protocol is a 20-visit protocol. We also use additional things like ice, interferential, cold laser. We'll also teach you what to do in the future, how to stay well and be well. Listen, I know we went over things pretty quick. I'm limited on my time, so I wanted to get you as much of the information out as I could. If you want more information, I would encourage you to either call our office at 565-7474 or check us out on the web at www.nevadachiro.com. That's www.nevadachiro.com. Thank you. This is Dr. Swolensky. I appreciate your listening.